Thank you for dropping by. I am Katsuyuki Chida from Chiba University in Japan. I will introduce a time series application of a method for analyzing a large claims database. Our target disease is nephrotic syndrome. It is a renal disease with massive proteinuria and hyperalbuminemia. Several kinds of protein losses cause several symptoms. Nephrotic syndrome frequency is 3 per 100,000 person year among adults, so it is a relatively rare disease. This scarcity of patients makes it hard to study risk factors before the onset. Compared to the paucity of pre-onset data in previous studies, in this study, we use a large receipt claims database. It includes longitudinal information on health checkups and medical claims across multiple clinical departments. The information allowed us to study diagnostic information before the onset. Nephrotic syndrome leads to several symptoms due to massive protein losses, and the symptoms are diagnosed as comorbidities. We hypothesized that these comorbidities were diagnosed at an early stage of nephrotic syndrome, and their combination could identify a population at high risk for nephrotic syndrome onset. This shows the subject selection. We used ICD-10 codes to define nephrotic syndrome patients. Individuals with an N0 for diagnosis were selected with these criteria. Then we set the control patients to match one by one with age, sex, and observation periods from individuals without an N0 for diagnosis. For the onset date on each control, we defined the same onset date as the matched case. In total, 822 patients were included in our analysis. They had 832 diseases expressed in the ICD-10 code and about 350,000 hypotheses for combinations, so we encountered multiple testing problems. To overcome multiple testing problems, we introduced the limitless RT multiple testing procedure (LAMP) collection method into time series analysis with the Fisher-exact test. To identify combinations of disease histories associated with nephrotic syndrome onset, we analyzed the presence or absence of comorbidities and their combinations within these time frames. Here is the result. The x-axis shows the time from nephrotic syndrome onset and the center of the analysis window. The y-axis shows the comorbidity descriptions. The nodes express a single disease and the edges express a pair of comorbidities. These sizes reflect significance. For our purpose, focusing on periods more than 18 months prior to the onset, the combination of other dermatitis and vasomotor and allergic rhinitis was more common within the time frames of 4 years before the onset. The triad of primary hypertension, dyslipidemia, and hyperuricemia, disorders of nucleic acid metabolism, shows the hyperuricemia. This triad was more common within the time frames of 3 years before the onset. Let's recap this presentation. Through time series analysis using LAMP, we found an allergic comorbidity pair and triad of non-communicable diseases with significant differences between the case and the control groups. Hypertension and dyslipidemia are already known comorbidities for nephrotic syndrome, so our strategy is consistent with the knowledge from previous cross-sectional studies. The results effectively reflected the medical history of nephrotic syndrome patients. Finally, the time series application of the LAMP to analyze large claims database is promising. That's all. Thank you for listening.